So Neupro or rotigotine, it's a dopamine agonist. So dopamine agonists are medicines that they go in, they sit on the same receptors as dopamine, but chemically they're not the same chemical, but they do the same job. The nice things about the dopamine agonists that we have on the market today is that not only do we have the ones that are pills like Requip or Mirapex that we can take 3 times a day, but we have versions of those medicines that are once a day, extended release. And then Neupro is one of these medicines that extended release, and it's a patch. So it's a little bit different. It's not a pill, it's a patch. The nice thing about the patch is it bypasses the gut in Parkinson's disease. So we know that in Parkinson's, you have bradykinesia or slowness of movement. And that includes all of the muscles of the body, including the muscles of the gut. And that's called gastroparesis in Parkinson's disease. So that when you swallow a pill, it goes into the stomach, but actually it doesn't get absorbed until it gets into the small intestine. But if you have gastroparesis or a slowed gut, that transition takes longer. Or especially if you're constipated, then that gastrocolic reflex isn't working and the pills or the food sit in the stomach longer. And then the patient notices that as a delayed on. I took my pill and it took an hour and a half, sometimes 2 hours to kick in when it should only take 30 minutes. And so one way to deal with that is to use a patch. We're bypassing the gut and the medicine is being absorbed 24 hours a day through the skin. And so we have less of those peaks and troughs that we have taking oral medicines. So that's one reason why your neurologist would pick the patch over a pill, a dopamine agonist pill. And the other thing is that Neupro seems to be gentler as far as side effects. We use much lower doses compared to Mirapex or Requip. So patients are less likely to have impulse control disorder, excessive daytime sleepiness, nausea, or vomiting, because it's bypassing the gut and we're using it as a patch, and usually it's a lower dose total milligrams than the oral dopamine agonist. So those are some reasons why you would consider the patch. So it does come a 1 milligram patch for RLS or restless legs. Then there's a 2, 4, 6, and 8 patch. Each patch gets gradually bigger. And then some patients do notice a little bit of redness or irritation at the site of the patch where you put the patch on the skin. That's why we want to rotate the patch so the same patch of skin doesn't get it the same 24 hours or 48 hours. And then as the patch gets bigger, you'll notice that redness gets bigger just because you're getting more of the drug, the rotigotine, and you can use some Eucerin or some cream there to help heal up that irritation.